Wael Saasouh is passionate about promoting patient-centered and clinician-centered medical care. He recently founded CaPER, the Clinician and Experience Registry, a platform that gathers insights from clinicians and patients about their experiences in everyday medical practice. Through CaPER, Dr. Saasouh seeks to identify critical issues and foster a healthcare culture that better serves the needs of those directly affected. Wael, go ahead.
Thank you, Don, and thank you, Denise, also for helping organize this, and thank you, everybody, for attending. We'll talk a little bit about CaPER, and this is a new initiative, and the data that I will present today is actually the first time it's being presented. So really excited to share all of that. We start by looking at individualized healthcare and how we don't really have all that data. We have a lot of interest in doing it, but we don't have a lot of data on the actual process and what's happening and what's important to the different sides of healthcare. And our specific focus would be the healthcare providers and the patients themselves, not the hospitals, not the business side of it, not the money-making side of it. We want to see how we can make healthcare better for the people who are very intimately involved with it. So we have very fragmented individual reported data. We can't really innovate with all of that, especially when it comes to clinicians and patients. We have all these buzzwords about burnout and about everything else, but we're not really working in the trenches to address that. We don't have a lot of secure access to actionable insights because most of the insight is private. Most of the insight is by individual institutions that would rather keep it to themselves, understandably so, for market power. And then we have a lot of missed opportunities as a result to align patient care with actual real world needs. As clinicians, and as a clinician myself, we always think that we're doing the best of what our patients need, which is sometimes true, sometimes not. So with my clinical background I'm an anesthesiologist, a full-time anesthesiologist and a researcher. I've done a lot of research on medical innovations and on patient-centered outcomes. And I started to identify certain places where we can do better. So we came up with a solution called CaPER, Clinician and Patient Experience Registry, where we wanted to understand the subjective experiences of those clinicians and patients. And the aim is to create, and this is the soft launch. We're creating a registry that provides anonymized data that policymakers and decision makers can use to drive healthcare transformation. And this is a platform that would capture those perspectives, and any stakeholders involved, whether from the administrative side or from the clinical side or for the research side for that matter, they can use to drive the positive change that we need. These are in the form of surveys where we send surveys not to targeted populations because that's a big limitation in survey research. We send surveys on national levels, and we can send this to several countries in the world. And as you will see later, the data that we get back is both actionable, timely, and very insightful. It's all de-identified, it's all anonymized, it's all non-incentivized on purpose because we want to capture the true sentiment of the respondents. Our key features are we derive those insights from experiences that the respondents report. And as far as we know, this is the first comprehensive and customizable registry of its kind. So we're not only asking the questions we want to ask, we're asking questions that people who would subscribe to this registry would want to ask. And it's very customizable and it captures very targeted feedback on specific topics. The aim is to support innovation in patient care and research, as well as in clinician experiences. And the topics, as I said, are customizable. These are some sample insights from a pilot survey that we did. This was more of a proof of concept. We launched a survey in the US and UK. We got 1,000 responses per country. And the topic was patient perspectives on in-hospital hemodynamic management. So we looked at how they felt about hemodynamic monitors, how do we measure their blood pressure, their heart rate, and everything related to that, and how they felt about it. So basically, we're looking at how patients felt about everything that we're doing, because from our perspective, we have all the cool technology and we're using it and we know what it's doing, but do the patients understand why this is important? Why is the hospital investing in such expensive equipment? Why are the clinicians so interested in the output of this equipment? So some of the insights that we can get is very simple, as in what do the respondents use to answer those surveys? And this is important for anybody who's interested in market research, for example. You can see that about 70% of our respondents, of 1,000 respondents in the US, use a smartphone. We look at age groups. We can look at specific questions. So this question was, how important is it that your clinicians share information with you during your hospital stay? You'll see that almost 66% thought it was very important, and then another 26% thought it was somewhat important. So the grand majority think it is important that clinicians share information, which, if you think about it, it makes a lot of sense, but I couldn't find this data in publications that so clearly stated. How important is it for you to understand the medical tests that you undergo? We run tests on a daily basis. Do we always go and explain to our patients? Not quite. And 90% of our respondents said it was important. Would you like explanations about the machines and the monitors around your bed? Not just put a bunch of monitors on and leave. Yes. More than 60% want to understand everything that's around them. And only a very minor proportion of the respondents didn't want to know anything. Would you like being informed about normal blood flow measurements and heart rate, not just the abnormal ones? Anything that's normal, would you still want to know? And the majority said they wanted to know immediately. How often would you like updates? Daily. Look at 70-some% wanted daily updates about their care. And then do you think, so what's the point? Fine, we will tell the patients, what's the point? Do you think that understanding your medical care better would help you manage your health and trust your medical team more in the future? 59% definitely yes, 33% probably yes. So it matters to the patients. It's not just a matter of sharing data and just throwing things at them. They want to be involved because they want to be involved in their own care. And this goes at the center of patient-centered healthcare. And a lot of people are pushing for that, but this provides more of a framework of how we can do it and what areas we can focus on. And then what would help you feel most in control of your health and involved in your treatment planning? The number one answer was involvement in treatment decisions, along with other things like being informed about the progress and so on. So then think of these questions and several others, hundreds others in our minds, that we can start implementing over time. And now we can start running the surveys, say, twice a year, and we see how the perspectives of patients are changing. And we can link that to certain big advancements in healthcare. Let's say a law is passed where you have to do something with patients where you share information, or anytime they get a device on, you explain to them what the device is and what it's doing. And think about the population effect of that and how patients will respond to our healthcare, which I think would be an improvement. And then how industry, device manufacturers, hospital systems, policymakers, stakeholders, how they would change policies and change, for example, certain details about their devices to cater to this interest from the patients and to drive more involvement in healthcare, which will be, one, very helpful to the clinicians because they want the patients to be involved in order to improve their health. And it would be good for the population because now we are targeting exactly what they want. And then we can tailor these solutions for diverse needs. Different stakeholders might have different questions they want to ask. They might have different data that they're interested in seeing. Researchers want to see aggregate data. Say industry, for example, will want to have specific information about specific aspects of healthcare. And we can do all that. Now, the support that this would need would be much like any startup where we're now looking for early adopters. We're just launching this. We want to shape the development of this registry. We want to have a certain number of questions that we're asking routinely, and then we want to have some customizable questions that go per participant in the registry. We want to spread the awareness, of course, and this is one way we're doing it. You're probably going to be seeing more about this on LinkedIn. We have some webinars planned, and definitely this cannot come cheap. So some funding and support would be helpful, and the funding is not the major limitation. It's the knowledge about what this is and that it exists and what it can do for everybody. That's the next key step. What we can offer is the data, of course. Data is powerful, and data can be very influential in what we're doing. And we want to capture the true data for these topics. And we can offer this data to everybody who's involved in shaping the initiative. We have different tiers of access to different kinds of data, and we can customize those insights based on the needs of the people who are interested in them. And then when it comes to pricing, what we can offer now is very flexible pricing because we're in the very early stages and we'd like to have as much involvement as possible. This is a sample of pricing tiers. The chunks that we go with are 1,000 responses per country. So let's say we run 10 countries in the world. Each country gets 1,000 responses or a multiple of 1,000. And then these are the average prices for new surveys that we're starting or existing data that people are just interested in retrospectively analyzing. And we're offering early adopter discounts, multi-country discounts, multi-year discounts, and a lot of optional services, which we can talk about in detail later. And now we're just planning to build this, scale it, and get it in front of people who would be interested in it. So please feel free to reach out anytime, and we can explore how this can align with your goals. And you can probably even help us shape and evolve the initiative itself. This is our contact email, and we're happy to answer any questions you have. And these are some QR codes for the website, the email, and the companies that are involved. Rewe is the survey company that launches the surveys. Ether Innovations is a company that I started to help drive medical innovation in general, and this is our flagship product. Thank you, everyone.
Great. Thanks, Wael. And this is really exciting to be at the forefront of this kind of research. It's really kind of turns things upside down, which is a new way of looking at it.